The U.S. crossed a major vaccine milestone Wednesday as new coronavirus cases continue to spike across the nation. More than 200 million Americans have been fully vaccinated against COVID-19. That's over 60% of the population. But cases, hospitalizations, and deaths are still on the rise. Experts say Thanksgiving gatherings and holiday travel have played a role in the recent surge. However, promising new data is revealing how one vaccine could protect against the Omicron strain. Nikki Battiste leads off our coverage from New York City.
Both Johnson & Johnson and Moderna tell CBS News tonight they're testing their current vaccine's effectiveness against Omicron and pursuing a booster to target the new variant in case it's needed. As the Omicron variant spreads across the country, Pfizer announced today its booster shot offers significant protection.
The booster shot could be the answer to the challenge that we're facing with the Omicron.
But only a quarter of eligible Americans have had a booster, just as COVID hospitalizations jumped nearly 30% in the past month, driven by the Delta variant. 4 states, Michigan, Indiana, Ohio, and Pennsylvania, are responsible for half of that increase. Michigan hit a record number of hospitalizations this week, and in South Africa, a much higher number of young children have been in the hospital with the new variant.
We have just, as you know, rolled out children 5 to 11, and today's data suggests we need to plan for also boosting them sooner rather than later.
Michael Dolston is Pfizer's chief scientific officer.
Do you think there's any chance we might need a 4th shot at some point because of Omicron?
I think it is very likely that we will need a 4th boost, possibly already this spring, particularly if Omicron continues to dominate.
The head of the CDC said tonight most U.S. Omicron cases are in vaccinated people. Nearly all have mild symptoms with cough, congestion, and fatigue. Meanwhile, the chief scientific officer of Pfizer told me they expect to have a vaccine for children as young as 6 months by the summer. Lana?
Nikki, thank you. Now to South Africa, where the Omicron variant was first identified. Coronavirus cases there are also climbing, but many COVID units are looking half empty. Debora Patta reports from Johannesburg.
Firmly in the grip of a COVID storm driven by Omicron, South Africa's 4th wave looks nothing like previous ones.
6 months ago, this COVID ward was overflowing with patients. Now it's completely different. It's half empty despite soaring infections across the country.
This was the same hospital during the Delta-fueled 3rd wave, overwhelmed, desperately short of oxygen and running out of ICU beds. But this time round, says COVID doctor Farid Abdullah, patients so far have had mild symptoms with very few requiring oxygen.
We've never seen that before. Normally in a COVID ward, you would have 80 to 90, I would even go as far as saying 95% of patients would be on some form of supplemental oxygenation.
South African scientists have released the first results on Omicron's potency, finding it significantly reduces vaccine protection, but not completely. Virologist Alex Segal believes antibodies from either vaccines or previous infections will stop the disease from becoming more severe.
I'm hopeful that because of all this previous immunity, that while a lot of people will be infected, most of the disease is going to be quite mild.
Although vaccine rates remain low in South Africa, just over 25%, so many people have been previously infected with COVID, it's providing high levels of natural immunity.
South Africa is ramping up its inoculation drive. Health regulators have approved boosters for everyone over 18, and the government is considering making vaccines mandatory. Lana?
Debora, thank you. For more, let's bring in Dr. Taison Bell. He's a critical care and infectious disease physician, as well as the medical ICU director at the University of Virginia. Dr. Bell, always a pleasure. So South African doctors are seeing fewer severe reinfections in people who have already had COVID-19. Tell us what this suggests about Omicron and natural immunity.
Well, we have seen that with the natural immunity from having COVID, the reinfection rate was 3 times higher. I certainly hope that we see the same course here, that Omicron tends to be a more mild disease. I will say that it's quite early, and South Africa does have a younger population than we do. So I think that time will tell, but certainly encouraging that they're seeing milder disease at this point.
And I think we should probably also just clarify when we say natural immunity, that means people who have previously had COVID, contracted the virus, and their body has built up defenses, not, as we've heard other people on social media describe natural immunity as something that could be ingested with placebos or herbs or the like. But that's not what we're talking about here at all. I also want to ask you about the reporting that we heard that so many of the people who have contracted Omicron have been vaccinated. Explain this to us.
Omicron has been causing infections, and what we've seen from some of the antibody studies that have come out of South Africa and from Pfizer is that the amount of neutralizing antibody, meaning the amount that's needed to really nip the Omicron in the bud, it does decrease. Now, what that means is that you could have a higher chance of having breakthrough infections. But we have to remember that the immune system is very complex, and you can't really boil down and predict what's going to happen based on one experiment. We have backup B cells and T cells that can kick in. And what I think this means that we can anticipate to see higher rates of breakthrough infections, but not necessarily having that translate to severe disease. And it's something that lands you in the hospital, particularly if you've been fully vaccinated and boosted. So it's a great idea to go ahead and get your booster shot if you're eligible.
So let me ask you about that, because according to a Pfizer study, 2 doses of the vaccine are, quote, significantly less effective at blocking the virus than 3 doses. That's what we're referring to in shorthand as a booster. The Pfizer CEO, though, also said that a 4th dose may be needed in the future. But as you and I have discussed ad nauseum, and the latest numbers according to the CDC here, more than 15% of U.S. adults have yet to even get their first shot. So how do you, as a medical expert, actually try to get people on board with the idea of 3, potentially 4 shots when there are still so many people who aren't interested in getting their first dose?
I think we still have to keep trying, Lana. I mean, the advice at this point is very simple, and that is if you're eligible for a dose, get that dose. And so that certainly means if you have not been primarily vaccinated, even if you've had COVID, you really need to get your first and second dose. But also, if you've been fully vaccinated, it's a good idea to go ahead and get that booster. All adults now are eligible for a booster 6 months out from their second dose. But every person that we see who has not been vaccinated yet or has not had a booster is a potential conversation. So we have to keep trying to reach out and tell people to call your friends, call your relatives, and make sure that they're doing the same thing.
And we've seen drug makers are researching variant-specific vaccines. Do you think that this is a shift in how we tackle COVID moving forward?
I think that's certainly a possibility. I mean, this is what we do for the flu vaccine. We update it every year to try to keep track of how it's changing over time. Certainly my hope is not that we'll have to take this on an annual or even biannual basis, but it's certainly possible. I think from a manufacturing standpoint, because it does take time to make these new updates, you have to prepare for that possibility. But my sincere hope is that being able to boost with the original strain, because we can do a lot quicker, we'll be able to nip it in the bud. And it does look like so far having that booster at higher antibody levels does offer really good protection.
And Dr. Bell, we saw a similar rise in infections last winter. It seems like we're seeing one again. Explain to us, how much is colder weather associated with the spread of COVID-19, and is it a causal relationship?
Wintertime is when that's sick season, especially, those of us who have young kids. It just tends to be an ongoing thing throughout the whole winter. There are a few factors. So our immune systems, kind of the defenses that we have to try to keep viruses and other germs out in the first place, they don't tend to work as well in the wintertime. Of course, you know that we tend to get together more indoors in the wintertime, and cold weather tends to do that as well. So this really combines to be a perfect storm for viruses that circulate. And so it's a good point that, if we add Omicron to Delta that's surging already in the country, along with flu and RSV and all the other things that can afflict us in the wintertime, add that on a national staffing shortage, that could present problems in the winter. So doing the things that we do that we know works to contain the spread of viruses in general, including Omicron, including Delta, wearing a mask indoors, avoiding those large gatherings, those are good ideas to do.
And always wash your hands. All right, one last question for you, Dr. Bell. Mm-hmm. According to a new report published by the Global Health Security Index, every country, including the U.S., remains dangerously unprepared to respond to future epidemic and pandemic threats. We have been talking about this for 2 years now. Tell us what still needs to be improved about our country's response.
Well, I don't have a lot of time because this would be a whole segment in of itself.
We'll talk offline later, but maybe just the highlights for our viewers.
Yes, I think the important thing is that we can anticipate to some extent where these new viruses can come from that could be potential pandemics, and we have to target research towards those areas. We have to do more global coordination when it comes to standing up clinical trials. We need to talk about technology transfer so that lower income countries that have drug manufacturing capability can actually have the access to technology through licensing or other ventures to be able to do that. And that's just the beginning of the list. Plenty to do, though.
All right. Dr. Taison Bell, thank you for joining, and thank you for all that you do.
Thank you.